Good afternoon, everyone. I'm Dr. Vinya, consultant in Apollo Health City, Hyderabad, working in the Department of Critical Care Medicine. Today, me along with Miss Annie, who is the speaker, will be speaking about decoding the codes. We'll be discussing about various hospital emergency codes which we encounter into day-to-day practice and how we respond to all these codes as a team. Okay. First of all, I'd like to thank ISSM Academy for giving me an opportunity. And I would like to introduce Miss Annie, who's working as a nursing superintendent in this hospital, who has more than 10 years of clinical experience and has been working on, as a superintendent also for more than 6 years. I would like to hand over to her. Thank you.
Yeah, thank you, Dr. Vinya. Good afternoon, everyone. Namaste. Myself, Annie. As we are discussing today, my topic is going to be decoding the codes. That is the detailed discussion of hospital emergency codes and the team response, how it is. So before I would begin my presentation, I would like to extend my thanks to ICCCM for giving me such an opportunity to present in front of this wonderful team. And I also extend my thanks to Dr. Sam Sundar, Dr. Deepak, and other members of the committee. I extend my thanks for the wonderful support that I have got from my ma'am, Usha Rani ma'am, who is the regional nursing director for Telangana region, Apollo Hospitals. I also thank Ms. Shirisha, who is the nursing superintendent, who has also supported me for this session. And I would like to go forward for the session. Yes, hospital emergency codes. What is that is there in everybody's mind? I'm sure you're all thinking of this slide. So you are right, that is code blue, code red, code pink, code orange, which we hear day in, day out in our duties. So let us understand what is the emergency code in a hospital. So as we all know, hospital emergency codes are coded messages often announced over a public address system of a hospital to alert to the staff of various classes of on-site emergencies. The codes are used intended to convey essential information quickly and with minimal misunderstanding to the staff while preventing stress and panic among visitors to the hospital. So with this, we understand the codes are meant to give us some important information to the hospital staff, not to create any panic situation to the attenders or the visitors who are there in the hospital. So to continue with this, such codes are sometimes posted on a placards throughout the hospital to give the information to the employees and also printed on employees' identification badges for ready reference. Hospital emergency codes have varied widely by location, even between hospitals in the same community. So confusion over these codes has led to the proposal and sometimes adoption of standardized codes. So let us look at what are the standardized codes that are used in many American, Canadian, New Zealand hospitals. For example, code blue indicates a patient has entered cardiac arrest, while a code red indicates that a fire has broken out somewhere in the hospital facility. In order for a code call to be successful, to be useful in activating the response of specific hospital personnel to a given situation, it is usually accompanied by a specific location description. For example, code red, the floor location will be a second floor, corridor 3, room number 212. So other codes, however, only signal to the hospital staff generally to prepare for the consequences of the external event such as natural disasters. So what are the standardized color codes used in other hospitals like Australia, like we are discussing? Code black, it refers for personal threat. Code black alpha, missing or an abduct infant or a child. So the list goes on like this. So let us see one more example of United States. Again, the code blue stands for heart or respiration stops. Code brown is used to indicate the severe weather. A code orange hazardous spill and code green emergency activation, and the list is continuous. So let us see what the codes that we usually follow at Apollo Hospitals group. So code blue is a cardiac arrest. So as we are discussing, however the codes are different from the hospital to hospital, the code blue is remains the same one in every hospital, that is for cardiac arrest. Then code red, it is an external disaster, which means some incident has happened outside the hospital, like example cyclones, flooding, or building collapse or something. Code browns indicates internal disaster, that is within the facility of the hospital. If any incident happens, that will be called as a code brown. For example, it is like a fire, explosion, or a major spill of any chemicals. So coming to the code pink, it is a child abduction, that is like any child missing from the hospital or sent with a wrong parent or any child related disasters. These are all related to code pink incident. Coming to code gray, this is mainly talks about the security threat in the hospital, that is workplace violence. We also follow code orange in our hospital, that is medical emergency. So we have a dedicated team, medical emergency team, which can be approached by calling a dedicated mobile number, because this is not announced in a PA system. So to activate these all the codes, we have dedicated number which was given to all the staff, that is 3000 or 3001. They can call and activate the any of the code. So code shall be announced thrice over the PA system and shall be repeated every 30 seconds for 2 minutes. Once the code is over, the all clear will be announced to give the information to the staff again that the code is clear. So to actively participate in these kind of codes, mock drills are conducted at least every 6 months in all shifts and done area specific, especially in vulnerable areas like OT, ICUs and dialysis. So what is the main point that to be followed when you hear a code? First thing is you should not be panic. On the call, mention your name, your location, and nature of the emergency. If I am the person who is calling to a 3000 or 3001 to give a code, so I should be mentioning my name, which location I'm calling from, and what is the emergency, whether it is in a code red, code brown, or you can in detail give it's like fire or a major spill, like that. Ask the listener to repeat what she or he heard. Once I tell the information, I should be clear about the person who is on the phone has understood correctly that what code needs to be announced. So to make sure, I have to ask the person to repeat. Listen to the announcements. So whenever the codes are announced in the PA system, we should be listening carefully. Assist even if it is not your job because it's an emergency codes. Be quick and follow the process of the specific code instructions. So let us move on in detail about code blue. What is code blue in hospital? Yes, many of you know. So code blue is called when a patient experiences unexpected cardiac or respiratory arrest that requires resuscitation and activation of a hospital-wide alert. So these cardiac or a respiratory arrest are handled by the code team of the hospital. However, a nurse who is nearby to the bedside, he or she will have to step in and begin immediately until the code team is arriving. So there is a code blue training for all the nurses at Apollo Hospital so they can learn how to properly and quickly respond to these codes. So the decision to call a code blue, when to call a code blue. So it will happen in a matter of seconds. So you have to think fast. You will know to call a code blue when the patient is not pumping the oxygenated blood that they need to survive due to cardiac or respiratory arrest. So in other words, if their heart stops pumping or they stop breathing, there you announce a code blue. Before you call for a code blue, make sure and do a quick assessment, that is for look for pulse and signs of breathing. If either of these is not happening, that's where you can call a code blue. When called overhead, the page takes the form of code blue, floor, and the room number to alert the resuscitation team. team where to respond. So like example which we have discussed, code blue, second floor, room number 256. This will be repeated over paging system. So who will be responding to the code blue? As we told already, there is a designated code blue team of the hospital to respond immediately. Every hospital, as a part of its disaster plans, sets a policy to determine which units provide personnel for code coverage. In theory, any medical professional may respond to a code, but in practice, the team makes is limited to those with advanced cardiac life support or other equivalent resuscitation training. So let us understand who are the people who are involved in this code team. So hospitals have different code team members, but it is usually composed of the following members, that is emergency physician on duty, unit nurse who is assigned to that patient, anesthetist on duty, critical care nurse, pharmacist, nursing supervisor on duty. These are the medical people who are involved in the code team. Other essential personnel, non-medical people, that are security and the medical social worker, is also part of code blue team. So when the team arrives, what is to be done? What is expected? So BLS, that is basic life support, has to be started then and there. Advanced cardiac life support has to start within 5 minutes of the code blue is announced. Code blue sheet to be filled at the end of the code to know what was exactly happened. Ensure the defibrillator is always charged, crash card, oxygen cylinder and the suction operators are readily available to manage the code blue. Job of the code team members. So now the code is announced, the team members are ready. What is the job that they should perform? So emergency physician on duty who is coming will be serves the code team leader. He directs medical management to be followed by the rest of the code team. The unit nurse who is at the bedside will be assisting the code team as needed. She initiates the basic life support and performs chest compressions. Critical care nurse who is coming for the code, she will be serves the code team leader until the physician arrives, and she will be mainly administering emergency drugs as director. Pharmacist job will be preparing the emergency medications and will be calculates the infusion rates, ensures drug incapabilities are avoided, and also ensures the crash card is properly restocked after the code is clear. Anesthetist on duty will be the in charge of airway management and the respiratory assessment, assists in intubation, secures settings of mechanical ventilator, obtains and reports arterial blood gases as ordered. The nursing supervisor on duty will be facilitating communication between the physician and the patient's family, assists patient's family in the waiting area as the code progresses, facilitates transfer of the patient to a critical care unit once revived. Other essential personnel of the team are also important. Like we said, security will be assisting with the crowd control. They will ensure patients' belongings are secured during the code, assist in transfer of the patient to the critical care unit once revived. As we discussed, the code will be announced that will be understood by the hospital members, but however, there will be some crowd gathering because they will be keen to know what is happening. So definitely a security will be playing an important role in managing the crowd and see to that the patient is shifted to the critical care unit as soon as possible. Medical social worker plays an important role also because the core team members are all taking care of the patient and the family will be left alone. So medical social worker will be providing an emotional and spiritual support to the patient's family, facilitates communication with the patient's spiritual or religious affiliates. So role of responders. The people who are responding to the code also should be playing a role. So the role of first responder is critical as they will start the resuscitation efforts to the patient undergoing cardiopulmonary arrest. The first responder should call for an help as soon as they find the patient is unresponsive. Ensure that the patient is flat on the bed, remove the pillow, check for the pulse. And the best site for this is to carotid pulse checking, not less than 10 seconds. Start compressions. The second responder will be responsible to bring the crash guard and other emergency equipment to the code area, secure the backboard under the patient, manage airway by using an ambu bag, switch roles with the first responder in giving chest compressions to the patients. The third responder will be responsible to turn on the AED or the defibrillator and use it for pulseless patients. Fourth responder is ensure that the IV fluids and the emergency medications are ready for use of the code team. Fifth responder will be in charge with the documentation that what is the things that are happening during the code, what medications that are giving, what is the patient condition in the monitor. So as we already discussed, these are the critical equipment which are required to manage any code blue. So defibrillator for giving the shock, and crash card which will be equipped with all the emergency medications and airway management material, suction apparatus and oxygen cylinder. These are the minimum and main important things that are required to manage any code blue in any of the hospital. So things that we should know when we are attending to a patient who is having a cardiac arrest, that is past medical history, current diagnosis, electrolytes, especially potassium levels, any significant lab values, any medications given that day, or patient has undergone any procedure on that day. So this is the minimum information that a doctor should know when attending to a code blue. This is the document which we are following at Apollo Hospitals, code blue running sheet. This will be documented by the fifth responder according to the timelines, the patient condition, and everything is documented in this code blue running sheet. So this is some posters that we have at our hospital. I have given here to the reference of everyone. The BLS, ACLS and PALS algorithms, which we are placed in all over the hospital, which will be reference to the staff readily available. We also conduct training for our nurses during the induction, that is on their joining to Apollo Hospital, BLS and ACLS. All our nurses are trained and certified by AHA. And training for nurses is also conducted by the pharmacy people to give them clear information about the drug calculations. This is a crash card training. The crash cards are designed uniformly across the hospital. All the emergency medications are kept in this crash card and will be maintained by the pharmacy regularly to see that all the required material is in the place. And all the staff are trained in this crash card. They know, each staff know in which rack what medication is available. So far we are discussing the code blue, code blue. So this is how the situation, the scene will be when you attend to a code blue. So code blue, this is the position that the responders will be taking. The airway management will be providing airway management and respiratory assistance as needed. Person is qualified to intubate if indicated. And the CPR position across from defib to see CPR audio visual tools for effective CPR. And crash card and defib register nurse hands out items and medications as needed, defibrillates when called for. The medication nurse administers IV fluids and the medications. The recorder, the timekeeper, documents all the actions of the code. Official timekeeper ensures code record is complete, obtaining signatures after the completion of the forms. Team leader, he is the important person in the team who will be in charge of the entire code, directs activities of the code to the remaining team members. So to summarize and keep you remember, if you found any unresponsive person, first we have to call for help. That is, call any emergency number, whichever is given in your hospital. Check for the carotid pulse, check breathing, start CPR and give rescue breaths and turn to a side. So easy way to remember is CAP. C stands for compressions, that is chest compressions. A stands for airway. B stands for breathing. This is approved by American Heart Association. So since we are talking that we have a code team, organized team in the hospital, we have a specialized trainings for the nurses, all that. So we also do analysis of our code blues to improve on our processes. So this will be happening. Month-wise analysis is done and discussed in the code blue committee meeting with the stakeholders and the team members. This will help you to improve on the missing links, if any, or also will be helping to strengthen the effectiveness of the staff training based on the analysis. So this is how the month-wise analysis will be going on. So for 1 year, we had 3 code blues. So this is a graphical interpretation. So what are the observations during this analysis? So it is noticed that the incidence of code blues have reduced after the initiation of early warning signs identification and assessment of critical cases and shifting them to ICUs. The resident will get a detailed report of critical patients at 5 p.m. every day. Thorough rounds are done by the physician and the nurse supervisor after 5 p.m. This has resulted in lower down in the code blue incidences after April 2020. So in detail, I will talk about this MET team in code orange. So the preventive actions which will be carried out after the analysis, that is a training, BLS training sessions for nursing and medical staff is conducted regularly on a regular intervals. Equipments, all the floors and the wards are sufficiently equipped with emergency drugs and necessary equipments. Assessment, this is regular assessments and reassessments done by the resident doctors and the nursing staff need to be reinforced. The committee, all the above points were discussed in the code blue committee meeting and conveyed to the team members so that there will be an improvement for the next time. So this is one slide which will giving you a picture of MET versus code blue numbers. Medical emergency team, which we already talked, they will be identifying critical cases and they move them to critical care unit if they need it, so that we can avoid code blues. So the number of MET calls are high than the code blue. So we will move on to code orange, that is medical emergency team. So we have a dedicated mobile number to call this MET call. So this team is a healthcare provider that responds to hospitalized patients with early signs of clinical deterioration on non-intensive care units to prevent respiratory or cardiac arrest. So the healthcare providers are trained in early resuscitation interventions and advanced life support and include physician and assistant nursing superintendent on duty. The team support responds to calls placed by the clinicians, nursing staff at the bedside who have detected the deteriorations of the patient conditions. So this is the early warning signs which we follow it. This is also printed in the clinical chart of the nurses where they document the vitals of the patient. So by seeing the color coding itself, the nurse will be identifying that the patient vitals are deteriorating, and so that she will be informing to the doctor for an immediate action. Moving on to code brown, as we told, it's an internal disaster inside the hospital premises. Any incident happens, it will be counted under internal disaster. Examples we have given like fire, explosion, or any major spill. So in case of code brown, what is that we have to do? Evacuate or move the patient to a safer zone. Activate the nearest fire alarm systems in case of fire. And then we have to call 3000 or 3001, mention the location and the nature of the emergency, and give the information to announce the code brown. So let us see an example of code brown. In case of fire accident, we should follow raise and pass. Assist fire marshals as per instructions. In case of major fire, evacuate orders or the code brown announcements under the supervision of the highest officials at the hospital. At that point of time, whoever is there, they will be giving the orders. So the training for nurses on fire management also will be done at our hospital with how they have to use the fire extinguishers and all. So as we said, in case of fire, you should remember the raise. R stands for rescue. We should rescue the patients first and then see that all the patients are in safe zone. A stands for alarm. That means we have to give alarm, that is calling and telling people to announce a code blue so that the people will get the help and there will be alert. C stands for confining the fire. That means we should see that the fire is not expanding more. Then E stands for extinguish. Extinguish with the extinguisher help. So how to use extinguisher we'll be seeing in the next slide. So we should use fire extinguisher using pass. In this, P stands for pull the pin of the extinguisher, aim at the base of the fire, squeeze the knob of the extinguisher and sweep side by side. This is how we should use fire extinguisher in case of fire. So when you hear a fire alarm, what is the team response to be? Should be closing the windows and doors, clear the hallways of equipment and furniture, do not use elevator in case of fire, absolutely no unnecessary outgoing phone calls, staff will assign someone to stay by the telephone, reassure patients and the visitors that they are in safe hands, review patient status in preparation for an evacuation, return to regular duties once the all clear is announced. So coming to code red. Code red is an external disaster which happens outside the hospital. So various disasters have occurred and are expected to occur within the proximity of Apollo Hospitals, Hyderabad, which including the following, that is cyclone, flooding, train accidents, because we have 3 major railway stations at Hyderabad city, vehicular accidents, school buses, aircraft crashes, terrorism incidents, building and construction collapses. These are the few examples that are for code red. So how code red is announced? How hospital staff will come to know about this code red? So intimated by CEO or the MS or the emergency head or the ND. Disaster management plan to be put in place. All required personnel to report into the head of the emergency department. Areas shall be designated as per the disaster management plan. The hospital telephone operator will be announcing code red 3 times based on the disaster management plan. All the departments need to fulfill their roles, ensure adequate oxygen cylinders are there, adequate nurses are relieved, prompt response from the doctors, availability of the food and the water, availability of stretchers and the wheelchairs to receive the patients, and also make sure that you know your role in the disaster. So this is the Canadian triage and acuity scale which we will be using in our emergency room to see that we can receive the number of people into the emergency room, and also to see that to allocate all the beds to them and who has to be attended first. So level 1 indicates resuscitation. Immediately the patient has to be seen by the doctor. Level 2 is an emergency. Within 15 minutes we can attend. Level 3 is urgency. Within 30 minutes we should be attending to these triage patients. Level 4 is less urgency. So within 1 hour you can attend to that patients. Level 5 is non-urgency, that can be seen 120 minutes within. So why this triage? So benefits of triage is to ensure critically ill or injured receive priority attention. It will establishes acuity and anticipates resources needed, predicts how long the patient can safely wait, supports effective utilization of the space and the resources in the hospital. It will also support the surveillance. It improves communication and public relations. Moving on to code pink. All of you know this code pink is child abduction. Any child is missing from the hospital or sent with the wrong parent or any child related disasters will all fall into this code pink category. Code pink denotes a missing of the child in healthcare facilities. However, Code purple may be used in conjunction with the code pink to provide additional direction and information regarding an abduction. So in this code pink situation, we also call 3000 or 3001, mention the location and the nature of the emergency, tell the details of the child, like age of the child, color of the dress that the child is wearing, when did you see the child last. These are the information which need to be given so that the people can be identify this child easily. Announcement on paging system will be done 3 times, ensuring all the entries and exits of the hospital are sealed, all bags and belongings, other aspects of suspect to be checked properly, all areas in the hospital to be searched for the child. When child is found, code clear will be announced. Then the doctor will be doors will be opened. Till then, the doors will remain closed. Moving to code gray, this is a security threat or a workplace violence. As usual, for this code also, we call to 3000 or 3001 and give the information. And this will be announced over a paging system. And security team will be responding immediately and appropriate intervention is done accordingly. So we are talking about all the kind of codes. So how we will know which code, what to do and all. So to give the information to the staff to participate, make them participate effectively, we do conduct mock drills every 6 months. So this is the summary of the drills which are happened in the last year. I have kept here for your reference. So fire, that is code brown, internal disaster will drill also happen. Disaster code red disaster, that is drill happened. Security threat drill happened. Code blue drill, child abduction, that is code pink, hazmat drill. All these kind of drills will be happening so that the staff will participate and learn more how to actively do in case of a real code. Thank you for your listening.
Thank you, Ms. Annie. It was a very beautiful presentation. All the codes have been explained very elaboratively, and these are very important because especially the code is important. Everyone should know, and they should be actively involved in that. And mock drills are very important also, and every one of you should attend for that. Any queries can be given in the chat box. We have few MCQs. Please type the answers in the chat box. First question. A 58-year-old male patient is admitted in the medical ward who is a known CKD and a background of hypertension was in a regular treatment. One day morning at around 4:30 a.m., patient is found not responding to any call and patient's wife reports the duty on who's on duty nurse. What is the next step that the nurse should take immediately? 1. Start CPR. 2. Defibrillate the patient. 3. Check the response of the patient and immediately call for help. 4. Administer adrenaline intravenously. Please type your answers. Yeah, most of them have given the answer 3, which is correct. Okay, thank you. Next question. Which of the following statements is incorrect? Code black indicates a bomb threat. Code green indicates an external disaster. Code red indicates an external disaster. Code brown indicates a chemical spill. No one is typing. Two of them have answered code as the answer 4. Good round. No one else? Okay. The correct answer is 2. It's not code green. If you discover a smoke or fire, what is the correct protocol to follow? Race, flame, react, spark. Very easy question. Okay, as expected, it is race. All are answering to this question. Okay. When a surgeon uses the cautery, the drape catches on fire. What is the first action? The answer is rescue the patient by pouring saline on the flames. Okay, let's move on to the next question. We follow the acronym PASS when using a fire extinguisher. What does PASS stand for? We have the 4 options. Please type in the answer. Yes, the correct answer is 1. Next question. When using a fire extinguisher, you should always aim it at the top of the flames. Is it true or false? Yes, most of you have answered it correctly. It's at the base we have to aim it at. So it's a false statement. A few questions on code blue. When you're giving a 2 rescue CPR, how often should you switch roles? 1 after every cycle, after every 2 cycles, 3 after every 5 cycles, 4 after every 10 cycles. Many are confused. Actually, it's every after 5 cycles of CPR. Still, some are posting as after every cycle of CPR. Everyone should be thorough in BLS and ACLS. It's not one. After the AED has arrived, after AED has delivered the shock, you should turn off the AED, continue CPR beginning with compressions, give 2 breaths, wait patiently for the AED to reanalyze. Yes, most of them has given the right answer. Don't wait, just immediately continue your CPR by beginning with compressions. Where should you palpate for a pulse on an unconscious adult during CPR? Carotids, radial, femoral, or brachial pulse? Right, everyone has given the right answers. Click around. Next question. When operating an AED, what are the correct steps to follow? Power on the AED, attach the pads, shock and analyze the rhythm. 2. Power on, attach the pads, analyze the rhythm, clear and deliver shock. 3. Attach the pads, check pulse, shock individual and analyze the rhythm. 4. Check pulse, attach the pads, analyze the rhythm, shock the patient. Most of you have opted for option 2, but always check a pulse before operating the AED. Only pulseless rhythms should be defibrillated. Your co-worker was acting strange. Which of the following suggests the possibility of a stroke? Slurred speech, dizziness, arm weakness, or all of the above? Okay, the correct answer is D. Next question. Asystole is a common rhythm which we see every day. It should be treated with all of the following except CPR, ventilations, defibrillations, epinephrine. Still the varied answers, but correct answer is defibrillation. Only asystole and PE we don't defibrillate the patients. These are the only two rhythms where we don't defibrillate. Next question. A 76 female collapses in the ward and the family calls the nurse. On arrival, she is placed on the monitor and the following rhythm is seen. You examine the patient and find that there is no pulse. What is the immediate next step you do? Give atropine, check blood sugar, initiate CPR or defibrillate. All are having varied views. Since this is a pulseless activity, this is a PA. What should you do? You should initiate CPR. Some of them have given us defibrillation. Next question. Patient remains in the below rhythm and is without a pulse. You have performed a round of CPR and the ECG is shown as below. What medication can be administered for further management? Amiodarone, atropine, epinephrine, vasopressin. I'm shocked to see many are typing atropine. There's no role of atropine during BLS or ACL test. We give Adri only. Next question. While you're continuing CPR or ACLS, staff asks you for all the possible causes of PERS. Which of the following are considered as a possible causes? Tamponade, trauma, tension pneumothorax, hypocalcemia, hypernatremia, hypothermia. C. Hypovolemia, alkalosis, hypokalemia. 4. Thalassemia, teratoma, tuberculosis. Okay, most of you have answered it correctly. It's A. Remember the 5H and 5Ts. Next question. The next rhythm check, patient demonstrates the following rhythm. Now there's a pulse, but the patient is hypotensive, unresponsive, and hypoxic. What is the next appropriate step in management? Most of them have answered it wrong. It's cardioversion and prepare to intubate the patient and secure the airway. It's not defibrillation. Most of you have answered as one. We defibrillate the patients only in two conditions. One is pulseless VT and ventricular fibrillation. Here the patient might be in VT but pulse is there. So you can't defibrillate. Again they might land into VF. Next question. Once you're cardioverted and intubated the patient, you get an ECG which demonstrates the following. ECG is shown as below. You reassess the patient and cannot palpate a pulse. What is the next step you would do? Okay, despite me explaining the answer in the previous question, still some are typing as 3, 4. This pulseless rhythm is VF, so immediately you have to defibrillate. Okay, thank you everyone. I think everyone should be participating and they should be thorough in BLS and ACLS. Most of them were answering it wrong. Any queries?
Since the few questions were related to in detail management of the code blue, we see few people are still in confusion and giving the wrong answers. So like today we dealt with the emergency codes. Next time I think you can attend some training on this BLS and ACLS, which will be helping to the healthcare workers in a large manner, because the code blue and management is very, very important in a hospital setting. So BLS is basic thing for everyone to know, but ACLS, when it comes to ACLS, all the doctors and the nurses should be aware of the rhythms, and they should be clear what to be done in which rhythm and all. So this, you can get trained yourself for the ACLS, that will be helping to save the lives. So with this, I take the opportunity to thank Dr. Vinya for her time spending and creating these MCQs for all of you, to make you more understanding about details about these emergency codes. Thank you one and all for attending the session. Thank you.
Thank you, everyone.